Alright, so good afternoon. We have some guests here with us today who are going to do some demonstration on the Ebola procedures, the PPE for Ebola. And of course, those of you who went to the disaster drill will recognize Ms. Laura Pressler and Lee Tinker. They're going to take care of showing you all kinds of good information today. If you have any questions, just let us know. And all your documentation for your clinicals, please try to submit that by Friday. Okay. What I would like to go through the system and make sure everybody has their documentation. I'll send you an email if I find something missing. Every now and then there are glitches in the system, and I want to make sure everybody's aware if there's missing a document. Okay. Any other questions? All right. Well, give you the floor. Thank you very much for coming.
My name is Lou Schaefer. I'm an RN and a licensed paramedic. I work at United Regional. I've been there for 14 years. Prior to that, I worked on an ambulance service in Seymour, Texas for 20-something years. So pre-emergency care has always been what I love to do. I'm like that adrenaline junkie type person. The emergency room, I started out as an LVN and worked my way up through RN school. As I was in the ER there, I became a charge nurse and I'm very passionate about education and equipment use. So from there, I moved into the role that I am in now, which is the educator and equipment specialist. And I've been in that position for 3 years.
I'm Laura Pressler. I'm the trauma educator. I've been at United Regional. That was my first job when I was 16. I worked in the cafeteria there at United Regional, about 10 years ago. And then from there I went to RN school, and I was an LVN first, and then went to RN school. I was a charge nurse in the emergency room for several years. And then for the last 6 years I've been the trauma educator. Along with that, I've probably talked to some of you guys, y'all probably seen my trauma lecture, but also Lou and I are both trained in advanced disaster life support, which is something that they train you, the proper donning and doffing of PPE for things such as Ebola. So that is how we kind of have been tasked with teaching the donning and doffing of the proper PPE.
So my primary goal for today is not talking about Ebola. It's talking about using basic PPE. And basic PPE, which is your personal protective equipment, is what PPE stands for. You should be using that on all of your patients that you're going to come in contact with any type of bodily fluid, blood, the works. So always remember, for some reason, back years ago, a long time ago, y'all probably wasn't born, I started on the ambulance service, and when I started, that was in 86, 87. The paramedics and EMTs on that ambulance service, when we rode out, I said, "Where's your gloves?" We was getting ready to get out on the trauma, and they're like, "Well, we don't have any gloves." I'm like, "You don't have any gloves? What are you going to do?" So from that point on, about 3 months to 6 months later, I took over the directorship. It was mandatory that you wore gloves, that you wore your seatbelt, that if you come in contact with a bloody person, that you put on a gown. You had goggles on. You have to protect yourself to be able to take care of those people. The primary person that you should always take care of is number one, and that's you. So today, keep in mind, basic PPE is what we want you to think about all the time. Protect yourself. Protect the people around you.
And your family.
And your family. Those of you who go to clinicals, when you leave clinicals, and you're in your suit, where do you go? You go to the grocery store? You go eat? You stop at any stores? You go straight home? Do you walk through your house? In the same shoes that you walk in a room? Some of you do.
No, we take it on
You should. I enter through my garage. My shoes stay in the garage, and my clothes go in the dirty hamper to be washed separately from any other clothes that I have. Because if you wear your shoes and you go through your house, what are you doing? You're tracking everything that you just saw that day. So you have to be conscious of what's going on. How many of y'all have been in a room, and I'm going to use nurses because you know how we are. So nurses, they go in, they take the gloves off, and they go trash can. We've all seen it. So what did that nurse just do? They just sterilized anything. Yeah, so now you're going to walk through that. So contamination is huge. So you want to be very careful when you're doning and you're doffing everything that you do. Okay, so we're going to start out. We need a volunteer, Laura. What do you think?
Guy with no leg hair over here.
Yeah, the guy with no leg hair. Come on down.
Y'all know why he doesn't have leg hair? We mobilized him and we had to rip his thing off and it ripped his hair off. He whined.
Who all participated in our disaster drill? We thank y'all very much. We have learned a lot from that. We appreciate y'all helping. What did y'all learn from the PPE or the disaster drill? How many people did you come in contact that you had blood and stuff on you that didn't have PPE on? A lot. And in a disaster, you're going to see that. So what we're going to do is we're going to don, which is put on basic and proper PPE. Okay? With that, we're going to throw in, just in case, if it was an Ebola type patient that you're going to take care of. We have our jumpsuit to go with that. Now, something I do not have here is the hood that goes over. We're not allowed to bring those out. Those are used only if we get that type of a patient, but I'll explain the procedure on when you would place that on. So the first thing you do, if you have a patient that you suspect is going to be Ebola, the first thing you want to do is go to your locker and you discard anything of personal value. Your clothes will come off. You'll put on paper scrubs. Your shoes, you're going to want to make sure you have an old pair of shoes there because you will not come out with those shoes. So you put on paper, you get rid of anything of personal value. Phones, jewelry, the whole works. First thing you do before you enter the room is you always clean your hands. Okay? So we're going to clean our hands. Next thing you're going to do is you're going to put on your inner gloves or your first pair of gloves. You're going to have to make the work.
I like to tell people that on your inner gloves, you want your inner gloves somewhat tight.
Yes.
You don't want to put on too big of gloves.
And then you'll move up in the size. So when you put your second pair of gloves on, if you've got smalls, then you'll go a medium. Okay? After you've done that, the next thing you're going to do is your shoe covers. And the shoe covers are actually boot covers that come all the way up to your knee. And you may need to sit down and put these on.
You'll need to sit down.
So for these, I always suggest that you take them, you roll them down, and you get the inside part here open up. Because on the inside, it's actually rubber against your rubber shoes, so it makes it very difficult to get on.
We chose someone tall for a reason.
We want to show you something.
How it's going to take off.
Next. The other part to putting your PPE on is making sure you have the appropriate size that you're going to need. So these boot covers, you notice for me it would go all the way up to my knees. For him it's not even mid-thigh. So you want to make sure you have the proper size when you're putting everything on. The next thing, so we're going for Ebola here. We're going to put on our jumpsuit. The jumpsuit unzips and zips in the front.
So does anybody know why I'm getting dressed too?
Your buddy that's gonna check her.
Exactly.
Everybody, you always have somebody in the room.
Outside the room, in the room, someone's watching. When you're looking at your stuff to put it on, you need to look at everything. You need to assure that it doesn't have holes in it or tears. You gotta be really careful when you're using gloves and unzipping zippers, because zippers, what do? They grab your gloves and make a hole in it, and then what does that do? Contamination.
Unzips in the front.
You can
There
see
you go.
it.
I'm watching to see how she's gonna.
Your feet are going to go all the way through.
I mean, I know how to do this. How about this? Or,
Again, these are paper, so you gotta be very careful. You don't wanna go shoving your arm through it or shoving ripping it here at the zipper line. This is when your buddy is very helpful.
It's a little tight.
It's under Armour.
And with this jumpsuit, you want your collar up.
I need a tall buddy about the same size.
See, I can't read.
I'm gonna pop the collar just to see what you need.
Okay, are you? Okay, see what happens when he moves his arms up? So would this be appropriate for him to wear?
No.
No.
During the real-time stuff, we're gonna have probably longer gloves, like the chemo gloves. Suggestion, has anybody seen the chemo gloves? They're long, they're a little bit longer, they're a little bit thicker. So your bottom layer of glove could probably be something like the chemo glove instead of just the regular blue gloves if you're really going into a really contagious patient.
And or you can use the sterile gloves that are pre-packaged, individual packages, because they have long cuffs too. And the mill of thickness is a whole lot better. All right, so after that, our next step is going to be our bonnet. This is really important for the females that have long hair, because you want that long hair to actually be in a bun, not just in a ponytail, because the weight of that pulls that bonnet back, and it pulls it up off your forehead, which you need it down low to be able to get good coverage.
So if you got hair, one of the things that we've noticed when we're doing all this PPE training is all this hair sticking out. Lots of people have their ponytails even. The ponytail, if you still have hair hanging out, you're getting that exposed, and then you're bringing that home with you. You can't take your hair off, so you need to make sure everything's up very tight.
Okay. Next thing you've got is your N95. So with your N95 mask, you're going to want the size that fits you appropriately. At our facility, there's a small and then there's a regular. And when you put this on, you're going to cup it in your hand. You grab hold of, turn this around.
This is your nose piece.
You're actually supposed to take the bottom one first. You come up to your face, pinching off the nose, come up with the bottom one up high. The top one comes around and goes down lower. And you pinch.
Well, wherever you guys
Pinch off
work,
that nose real
most
tight.
places will always, every year, we get TB fit tested in our facility. You put this mask on, they put this hood over our face, they squirt saccharin, and you take deep breaths. If you can smell, if you get that saccharin taste in your mouth, then this mask is not for you. That's very important, especially for TB patients.
So if you don't have a good tight fit with the mask, you're not going to be a candidate to take care of that person's TB, Ebola, any respiratory particulates at all. Another thing, guys who have beards are not going to be able to get a good tight fit. You will not get a tight seal at all. So, next step is our outer gown. So these jumpsuits that we have on right now, the white ones, are splash resistant. They're not waterproof, so if you was to take it and stick it under the water hydrant, the water would go through eventually. So the outer gown is going to be your protectant. Always when you're opening, you're always examining and inspecting your PPE to make sure there's no cuts, no open areas.
Now, normally, what do we do with these, with the ties?
Bring it around
Normally, you
people.
wrap them around you and tie them up front. Do we want to tie anything up front when we're dealing with poop and vomit and stuff like that?
No.
So everything you want to do, you want to tie behind you. And this is where your buddy comes in. So your buddy will go in there and I'll tie him. And he rips it down. So he would already be pretty much close to done. He wouldn't be going into the ring probably with his equipment on.
You also want to make sure that collars are up. Your buddy is there to make sure you are very well protected.
Get your buddy to ties fast because it's really hot.
Is your hair out?
Yes,
Probably
it is.
as
her buddy, you need to help her pepper here. Well, I don't really like her, but no, I'm just.
Are you hot?
A little bit.
Okay.
Next up is gonna be your splash shield. Just pull it around.
You might flip over to the back. On these, you don't want to do a lot of crazy tying, because when you go to get it off, you want it to come off easy, okay? So don't go tying a knot in the back of it, because that means you're going to have to rip it. And anything that you have to rip means you're going to be putting aerosol in the air. So you want to tie it in a good bow. Oh, really hot, it's hot. These things are really, really hot. So when you go to do stuff like this, you need to try to get in the room, get everything done, and get your business done, and then come out. You won't be very hot.
Okay, what do y'all think? What are we missing? Your outer gloves. Now, if we had the hoods, you wouldn't put the splash shield on at this point. You would put the hood on. And the hood would come down, covering your shoulders and across the back, so that you have nothing exposed.
So you put your thumb through this hole, so it'll hold your gown down. Sorry, I didn't get that. Wait. Does this look easy? No, it's not. I'm in a kind of menopause a little bit. So I'm really hot.
So at this point, you'd want to make sure that everybody's covered good. You're going to inspect, make sure there's no holes in the gown, there's no holes in the gloves. Okay? The last thing you do before you enter the room, which sounds kind of silly, is you clean these outer gloves. Okay, so you would go up to the alcohol, you would clean those gloves, then you go in and you take care of the patient. If this is an Ebola patient, some of the questions that come up was, how am I going to listen to breath sounds? So if you have a hood on, it would be difficult. But remember, you're doing basic care of these patients. So you're not going to get in depth. These patients are not going to go to CT. These patients, X-ray, are not going to go into that room. Respiratory is not going to go into that room to take care of them unless they're going to be intubated. So it's minimal care is all that you're doing for these patients. Minus the white jumpsuit, everything else is basic PPE. This is what you should be putting on. If you're having, if a trauma's coming in, how many of y'all watch, emergency trauma on the TV? Everybody is already dressed in this stuff before the patient ever gets there on TV, correct? That's the way it should be in real life. That's what you should be doing as well. All right,
But also, not just traumas. So what happens if you're putting a central line in? You're in a room and you're helping the doctor put the central line in, or you're putting a chest tube in. I was really bad the other day. I told her, I said, I'm being bad, I'm not. But wearing eye cover is very, very important, especially because if you think that fluid can splash on you at any minute, what you think is a controlled environment, go into CAT scan with somebody. I mean, if they've got an IV going and they go to CAT scan, that IV can be pulled apart and that blood can go everywhere. So you always need to be very prepared.
And especially in our traumas, when we're giving blood and we're giving it at a fast rate, it's in a pressure infuser. So if that tube breaks, it comes out at full force. And I mean, it covers everybody and everything in the room. Very important that you have it on. You take care of the patient, you finish up, and you're going to come out, and normally you're going to come out in what we call an ante-room, which is where you're going to don and doff everything. So when you come out, you need a blue pad that's on the floor to where when you walk out of that room, that's where you're going to step, and that's the only place you're going to go. So you want your red biohazard container there, which if it's an Ebola type patient, you're going to have 3 red bags that all of this is going to go into. Next, you want your hand gel to be handy. Real handy to where you can do that and clean, because you're going to be cleaning in between everything that you're taking off. So if we step out onto our blue pad and we're going to doff, we're going to take all this off. Okay? The first thing you do is you clean your hands as you're coming out of the room. Next thing is you examine to make sure there's no cuts and no tears. If there is, that is your thinking, okay, I've got to be very careful and I want to be very cognizant to where this tear is to make sure there's nothing underneath.
And also, if you got debris, like poop or whatever you got on you, you want to know where that is, so you're more likely to get not spread.
So the person who is observing these people taking it on and off is actually helping them. That is your best friend in life. They're going to tell you exactly what to do. They're going to assist in everything that you're doing. So at this point, the observer, who would be in the full basic PPE, is going to untie them and get them ready to doff. Okay? And you're doing this very carefully, very meticulously. You're going to be very slow about coming off with this.
One important thing while you're in the room with the patient, do you ever, when you have a sterile field in front of you, do you ever turn your back on that sterile field? No. Why? Because you don't know what happens to it if you turn your back to it. Same goes with this. You want everything on the front of you because your front is covered. So if you're in there cleaning and you're doing things and you're walking away from your patient, try to stay facing your patient. If you get any debris on you, you want it on the front. So what I'm going to do is I'm going to start rolling this. I'm going to start rolling this to where it counts. And when you're doffing, you never want to reach up and touch around your neck. Okay, don't go in. So I'm going to roll that back for them and grab it at your chest.
Down low.
Grab it.
There, grab right there. Okay. Let me untie you.
Untie me and I'll go. So I'm on my nasty field here, my little square. I'm going to do that. I'm going to reach here in front and then I'm going to start pulling. And instead of ripping it,
Keeping your arms still in your sleeves.
out
Out away from you. Okay, and you're rolling this up. You're rolling it all inside itself up into a ball, keeping your arms still in your sleeves. Okay, roll all the way up. The tails are the devil. Make sure they don't touch you. Okay, all right. Keep your hands still in there. All right. So once you get to this point, what you do is slowly start to pull this out, your sleeve out. Okay, and as you're slowly pulling this out, when you get to right there, turn your palm over. Notice how right here you can now use this thumb into here like that and slowly pull that off of that glove. Maintaining that you're only touching things that are on the inside of what you had on. And then the same thing, start to pull this sleeve out where you can get to there. And once you start to take that off, you're done touching it. Don't let it fall. Don't touch. Okay, drop. Okay, it's going to go into the red bag at this point.
and that's my red bag.
Next thing you're going to do is clean your hands. Okay? This is the tricky part here. So you grab the front of this white jumpsuit, pulling it out away from you, and you reach up to that zipper.
You may even want to lean forward just to get everything away from you.
You don't want to touch anything on the inside. You only touch the outside. Now you notice that the jumpsuit he put on is too small for him, so he's going to need help to come off of his shoulders. And Laura's probably going to be able to come off of her shoulders without any problem. Maybe, maybe not.
Say that.
So if the helper's going to come in and help, I am clean, so I don't want to touch anything on the outside. I want to touch from the inside. So I'm going to go from the inside, coming off of his shoulders down to there. At that point, he's going to turn and grab that, and you're going to be rolling it inward, this way. Grabbing and rolling inward. There you go. And as you're doing that, you make sure that this front is rolling into itself as well.
Okay.
Notice how Laura is rolling it all the way down. Okay, once you get it past your knees, you can scoot back to a chair, keeping your feet apart. And the reason for your feet apart, you'll see here in just a second. Okay, keep rolling.
Remember, your feet are always on your blue pad or whatever you have on the ground, protecting that ground. You don't want to put your, well, don't you want to cross your legs?
Feet apart.
What am I doing if I cross my legs?
I'm
I'm touching my other leg.
When you come down,
You don't want to do that.
here, you're going to slide this arm out. As you slide that arm out, you maintain rolling everything inward. Okay?
So everything is
Now go
rolling
to the
into
other
a ball.
one, the same thing.
I'm gonna drop it into the red bag.
Rolling it. Now when you get here,
Hand hug.
when you get down to this part, what you do is you roll up on your toe, bringing your heel up, and you roll that off of your heel. And then you bring your heel back and your toe up. You always maintain your feet on the floor. Yep, just like that. And now pull your, don't put your foot up, come back. There you go. Rolling inward. Rolling inward. Are you going to fall out? Okay, same thing on this side. Up on that toe.
So the key is roll, not jerk.
Back.
It rolls into itself.
Rolling. Maintain
In
the
the ER in all of our clinics that we went and did PPE training, we actually put fake poop on people.
So
Bloody poop, so we can see if you're cross-contaminating yourself.
all right, so we've got that off. The next thing, you clean your hands. Right. Now you're going to come off with your shoe and boot cover. So you'll grab from the outside, rolling it downward like this. Same thing when you get up on your toe, over that heel, rolling everything inward, and then back on the heel, up with the toes. All in, everything is turned into itself.
We're gonna throw this in the red bag.
Red
Am I gonna step with my clean shoe back down on that path that was dirty? No. No. I wanna put my leg somewhere else. You wouldn't talk that like that.
In ADOS, when you come off with everything, you actually step out of a bag. So everything comes off into a bag, and then you step out of it barefooted is the way it works. All right, clean your hands. This is where I highly suggest, yes, ma'am,
You said clean your hands. Is it with hand sanitizer or you wash it?
hand sanitation, what's on the wall.
So alcohol bloody. I mean, that blood will still be there.
That should be in there already.
That should be on the inside because you
Okay,
have
that's your first glove.
because you fold all that nastiness all off inside itself into one ball. Your inside gloves is your protector. Now, if you have stuff on it visible, then at that point you would clean with alcohol and get rid of those gloves and re-down the inner gloves. So what I suggest at this point is we're going to come off with these gloves. To come off with these gloves, you're going kind of the opposite of what you normally do. So what you do is you're going to grab at the palm, and you're going to start and use your fingers to slowly roll that out, inside out into that hand. Use these fingers like that. Just, yeah, if you snap like that, things are going to fly.
Careful. You got it.
The next one goes underneath. Nope.
No.
The next one goes underneath, and see how I curl my fingers in? And I use that to slowly come off. And everything's inside out. Perfect. Red bag, clean your hands. Now you're going to put on new gloves. Because the next part that you're going to be touching is all your face.
The people in the nursing staff that were actually in Dallas, they got kind of exposed. They feel like that they got exposed from their face and neck. Because they're going up here and doing things. So this is where you want to be very careful.
So what you'll do is with your hands, you'll come all the way back, untie the bottom, down. Untie it, just let it go. Okay, just let that go. You don't ever want your hands here, ever. You always want it behind you. So the next one, you're going to untie the top.
Be careful about the way you touch it.
When you come out with that, you come out and away from your face. There you go.
Lean forward.
Into the red bag, clean your hands. This is the hardest one to get off, okay? You've got to reach back and grab both of those rubber bands. And when you come off with this, those rubber bands are going to want to pull your hands to your face. And I always suggest that you let it kind of cup up under your chin. When you get to about right here, leaning forward, and then slowly come off with that so that mask doesn't spin back in front of your face. Your other rubber band.
So if you get a big tangled mess back there, like I've got right now, And instead of just taking your mask and then hand hygiene and taking your hair, you can do the same, you can do it at the same time, which is so much easier. So you want to lean forward, pull everything away from your face.
Notice how even as careful as she was, there you go.
It's
away
still
from your
snapped,
face.
it's
Still
still popped.
snapped. That's the hardest thing to come up with. Clean your hands. I've done this. I just think you didn't even get to take care of the
I was
patient.
like, I bet I got some sweaty rings right there.
So the last thing you've got is to get rid of these gloves. So start from your palm, like we did a while ago. Use those fingers to slowly roll that off, inside out. That goes in that hand. There you go. Then underneath, using these fingers to help you pull that off. Red bag, clean your hands. Okay. What do we have on what's left? We have our paper scrubs and our shoes. If it's a true Ebola patient, you're going to come out of your paper scrubs, out of your shoes. All goes bye-bye. You go take a shower, and then you read down some paper scrubs and either shoe covers or something, and then you're done. A shower.
That's the Ebola patient that actually is having
Yes.
his test.
If it's basic PPE, then once you come out, there's bleach wipes, there's peroxide wipes that you can wipe the bottom of your shoes with if you're going to go from that to another
How
area.
far are you walking without paper scrubbing your shoes on?
You haven't. Our ER is set up for room 15. It has an ante room and it has a bathroom with a shower. The bathroom with the shower is yours, not the patient's. Everything the patient does goes in triple red bag and goes straight to the incinerator. They don't use the facilities at all. They're using a bedside commode. And if they need a bathroom, do a swimming house. And everything goes in a triple red bag and from there to the incinerator. Everything's incinerated on site.
And we would hope that patient would leave us and go to a facility that we can take care of them.
Yes.
So if you went in and out of that room 3 or 4 times, you'd be taking a shower every time you come in?
You're not going in and out of that room 3 or 4 times. If you're taking care of that patient for your shift, the ante room is your nurse's station, basically. So you stay in your scrubs, that is your break area, you have this bathroom, and you take care of that patient. For our facility and our policy, if that patient's gonna be admitted and they have not been ruled out, that they don't have it, you go with them over to, in our designated area is pediatrics, which they clear the floor of pediatric patients, and that becomes the Ebola floor. A nurse, myself, I would be quarantined to that area for 21 days and/or until they rule them out as having Ebola. And that's where the patient goes. They have 3 negative pressure rooms over there. Doctors the same way. You limit the people that are going to make contact, and those are the people that are going to be put into the isolation.
We have to do testing on those patients. We're bringing this little tester, which is very expensive, into the room. We'll be testing the patient, and that will be thrown away when they're done.
That's a $15,000 iStat machine.
So this is a big deal.
Yeah.
And so we don't want this here. So very, very important.
But the most important takeaway of this is basic PPE. So your gloves, your mask, the gowns, the TB mask if you have a TB patient, and making sure you're putting them in the appropriate place as well. If you have a TB patient, you're putting them in a negative pressure room. Use your basic PPE to protect you and everybody around you.
Ebola's scary, the Hep C, HIV, so many things that are a lot more common. People walking around in the mall, you're walking right past them and they have all those things. And so those are the things that we really protect ourselves from, okay? So Ebola's scary, but this stuff is worse, so be prepared for every situation you get into. Don't get in a situation where you don't have your PPE on and then you get splashed in your face by chest tube drainage like I did a couple weeks ago. Bad deal. So you don't want to do that, so be prepared in advance.
Yeah, it's the, everybody was freaking out about the Ebola, and I'll just go ahead and tell you, true story of the ER here. So they're all freaking out about a patient that we was ruling out that had Ebola that we had in one of our front rooms. And we had a code that came in from EMS. The nurses go in to take care of them, and nobody had on their basic PPE. They had on gloves, and that was it. There was nothing obvious about this patient. They're just doing compressions, the patient's intubated. They suction the patient, and when they do, then throw up comes out of the tube and gets the nurse in the eyes. Had she had the splash shield on, which is basic PPE, she would have been protected. But instead, she has to now go have her labs drawn, in 3 months have her labs drawn again, and in 6 months have her labs drawn, and then in a year have her labs drawn.
The patient have the labs drawn.
And the patient, if the patient survives, which, most likely I don't think that one did, but those are the things. You have a year that you're worried about, oh my gosh, what did I just get? And even if you're testing negative, still in your mind, you're worried from this day forward, oh my gosh, what have I contracted? So use your basic PPE, very, very important. Any questions?
Yes, I noticed that, first of all, when you're taking off the paper scrubs, do you wear the new ones the same way?
Inward, yes.
Because I noticed when he was taking off the shield, the straps sort of were lying on top of the shield.
You let go of that, it's all on the back. Remember what we said, don't ever turn your back on anything? So you let go of that in the top when you come out and away from your face. You always have the possibility that you may have something, but where do you go after that? You go to shower, is the whole hopes of that. So. Any other questions?
You said in that situation there would always be two nurses. Does that mean that, like, say for instance at United Regional, they have to take turns taking showers, or how would that work?
He's gonna be dressed out. I'm gonna watch him dress out. I'm not gonna dress out at the same time he is, right? Because I don't watch I sit here and get sweaty hot while he's going in the room.
Oh, so you'll alternate.
So we're gonna alternate.
Okay.
While he's in the room working on the patient, when he's getting ready to come out, that's when I'm gonna put on my PPE. So in case I had to go back in there, then I'm ready to go back in there. He's coming out. I'm gonna watch him come out. I'm still clean, but I'm watching him come out. He'll get undressed. If I gotta go back in,
The whole idea is that the observer never enters the patient's room. That's the
I would
hope.
like not to.
Yes, that's our hopes, is that you never enter that room. You're there just to observe, to make sure in a systematic approach that you apply all the right stuff and you doff everything appropriately.
So if you want to give like, let's say you want to give him like medication and stuff, is it the observer that's gonna bring it?
Observer's gonna go get your meds, and or you can have somebody from the nurses station bring them to that empty room and hand them off to the observer. You don't go anywhere. And in the emergency room, we don't do KBMA where we scan our medications. Everything we do in the ER, we pull out emergently.
So there won't be, we have computers in the rooms,
Your document will still be
everything will still be in there.
The paper scrubs go like when you're taking can they go over the head or can you pull them off like all like the gums and stuff?
The ones that we have can go over your head, but you have an observer that, for me, I would have the observer that would cut up and across the arms to where it would just come off the front. There's numerous ways for you to come out of this.
Those paper scrubs should be clean.
They should
If
be
you donned and doffed appropriately.
appropriately. Any other questions?
What about classes?
What we have found on people who have glasses on is they cannot prevent being fogged up. Now, the hoods is a different story. If you have on the PAPAs, which is the miniatures, the little respirator, you don't have an issue. But with the N95 and that splash shield, they all fog up, so you wouldn't be a good candidate to go take care of them. We have numerous
He would not be
nurses.
the one we would probably send in there.
Yeah.
It's gonna be someone shorter. He's gonna
Yes,
send
ma'am.
him.
Okay, but the nurse, like, you have the choice to say, no, I don't wanna do this, right?
I will tell you, at United Regional, the nurse has the choice to say if they will or will not take care of that patient. I will also back that up and say, as a nurse, you take an oath to take care of these patients. So you're fighting a fine line.
If you're breastfeeding two twins at home, then you would not be one
Right.
that would wanna go into that room because you're going to be isolated.
In the emergency room, there's a sitting duck. Who is that sitting duck? The intake nurse. The person who is triaging patients who walk in. That is a sitting duck. And I don't mean to say that badly, I'm just saying there is always going to be somebody that's going to approach that person the first time with nothing on. And in that situation, what we have taught them is, during that conversation, if you you determine that you think a patient has Ebola, you explain to them, give me a second, you step back, you
3
clean
feet.
your hands, at least 3 to 4 feet from them, clean your hands, you don all of your equipment, your basic equipment, and then you don that same stuff on that patient to transport them from point A to point B, which is room 15 in our facility.
So what happens if room 15 is already taken?
We move the patient out of 15. If it's not an Ebola type patient, we move them out. If it is, then we'll go to the next room that is closest to it. But we're hoping at that point we've already moved them on. If it's somebody that we haven't ruled out, which the ones that we've had 4 hours before the max that we've seen so far, we've had 3 patients at United Regional that we, have ruled out, but with less than 4 hours, we've already said no, that they're not a candidate. Thank you. So,
And everybody talks about, well, how far do you gotta walk? To get to a shower and things like that. By that point, you're not gonna care. I'm more worried about getting clean than modesty. And nobody's ever gonna ask you to walk around naked in the hospital.
right.
But
All the doors in 15, everything is solid doors. So, all you have to do is turn around while they, go into the shower. And we have all the equipment in the ante room for them to put on some clothes.
Okay, United Regional is ready.
Yes,
What if they're going out into some little rural hospital that isn't ready? And the patient comes in, worst case scenario, what should they do?
Well, through the Region Advisory Council, we've also sent out all the information. So all the hospitals should be ready. Texas, we live in a pretty forward-thinking
Proactive,
state. We're proactive. So, my emails were just burning up that first few days, sending us, this is the latest stuff for EMS, for hospitals, rural hospitals. And so they're just hammering it out there. And we also give money. Money passes through us to go to these rural hospitals to prepare for things such as this. So the hospitals, smaller hospitals should be prepared, but they also know that they can contact us because we are the hub hospital of our region, and we'll also help give them. We have a emergency preparedness group of people that are ready for anything like that. They can come. They'll take a truck out there
and it serves our 12 county area.
Should that be a question they ask if they go interview for jobs
It should be, yes.
about their preparedness?
You gotta know where you're gonna work. Sometimes when I talk to you guys about, I don't know if anybody's seen my trauma lecture, but at United Regional, I can't intubate somebody. I'm not gonna put a chest tube in somebody. I'm not gonna do this or that. But who knows where you're gonna be? You may go to the military. You may be in Iraq, and they may train you to put a chest tube in somebody. Or you may be in Henrietta, and you might be trained, and you might have to intubate somebody yourself. So always be familiar with what the protocols and the procedures are in the places that you work. Because you can listen to us, because we know United Regional, but we don't know what's going on in Electra and Holiday, and all the different clinics and all the different places. So just be very familiar. And then if you're not prepared, the place you're going to work is not prepared, help get them prepared.
Exactly.
You guys are young and smart thinkers. Go out and make changes.
It's all about knowing what your scope of practice is, because it's very hard for me, being a licensed paramedic and an RN. I have to know the difference, because as an RN, I can't start an EJ in the emergency room. I can't intubate the patient. I can't dart the chest. There's lots of things. But when I walk out of that door and I'm a paramedic, I can do all those things. So you have to know what your scope of practice is and not to overstep those bounds.
See a couple up there smiling. Those go to our trauma nurses. Because we get excited about darting the chest.
Any other questions for us?
The question is, okay, I know like you guys change certain things on your database, like the accident people recently traveled to, a country. But what if somebody that's here contacted it and they did say, they never traveled or they didn't know the person they were in contact with traveled, so.
There's always that possibility. we're still gonna treat the patient based on their symptoms. So if their symptoms are looking more like it's something towards the Ebola versus the virus or the flu, then that, we're still gonna put them in isolation. And a lot of that does come out later. Anybody who's been to the emergency room, I can tell you, as being an intake or a triage nurse, when that person comes in and you ask them, so what are we seeing you for today? They may say, oh, I stumped my toe. And I'm like, okay, they stumped their toe. And then when they get back to the room, another nurse walks in and says, what are we seeing you for today? Well, I kind of had sex with this girl last night and I might have caught something. You're like, where does stumped toe come from that? And then when the doctor comes in, it's something totally different. So the story is going to change all the time. So you don't always get the correct information that you want up front. So you just have to be prepared. And at that point, if you find out, then take the precautions then. Anytime you suspect that it's an Ebola patient, you also want a list of all the people they come in contact with. And that's one of the things we do at United Regional. So if you walk in the door and I come in contact with you, then we are also going to have to go back and look at how many people did they pass in our lobby during that time. Out of our people who were signed in, we go back and we look at all of that. And we track everybody that person come in contact with. And those questions are asked later on. Any other questions for us? Yes, ma'am.
What does Ebola treatment involve, since you mentioned something about basic care? Like when you have the patient, what are the treatments?
It's basic treatment as far as if they're vomiting diarrhea, we're going to treat that. If they're vomiting blood, then we're going to treat that if we have to give them blood. The other thing with that is if the docs determine that it is Ebola, the whole plan is that we don't keep them at our facility. There is 3 places in the state of Texas that is going to take care of those patients. So at that point, we would be looking at shipping those people out and not keeping them here. But very basic care. I mean,
They would not ship them, right?
no.
We would transport.
They will be transported by one of our EMS crews and or flown. It depends on how they're going to do it.
I'm curious, what are the 3 hospitals in Texas?
There's one in Houston, there is one in Richardson, and the other one was San Antonio. And then, of course, Nebraska is probably the biggest one that's trying to take all the patients at the moment.
Like, for instance, you asked about equipment and basic care. The man who died from the Ebola, they went all the way to doing dialysis on him. You know, that's extreme. And that's something that here at United Regional, I mean, just think, if we have to throw an ISTAT machine away, what are we going to do with our dialysis machine that we've had to use on him? And all the amount of staff and everybody that would be risk exposure to that. So we would not probably here at United Regional Wichita Falls be doing that. That he needs a higher level of care at that point. So.
Yes, sir.
The PPE which you received today, how effective it is, because we never tested it before. How safe is it we just do that way? Because the movie and on the internet, what we see is everything is covered.
And they're wearing respirators.
Yeah, and then they just
CDC is, yes.
Yeah.
You don't know.
We don't know. They thought the nurses that were taking care of the patient were protected, and they weren't. So then they sent out new recommendations, and they sent out more recommendations, and they sent out more recommendations. We're not completely covered here because we don't have the hoods on, okay? But we didn't bring those to train because they're more expensive. There are several people in our facility that have been trained with Lou and I. We can go in with the respirator. But let me tell you, you're going to go in that room and you're going to stay in there an hour tops before you're so hot that, you're dehydrated. It's not a pleasant experience by any means. So if it gets to that situation where that patient's spewing bloody emesis and diarrhea and things like that, then that's that patient that we want to get out of there as quickly as we can.
The other thing is they don't know at what point did you pick up that contamination. So you don't know. And they don't know. So it's the unknown.
We're learning.
Yes, we are.
Well, I'm just thinking like, you say that you would roll out if the patient is in the location or not, while they're in the room that you're taking care of them, or is that determined before you transfer them to the room?
That would have already been determined. So the way it works is a patient comes into our facility, we call our head person, which is Dr. Hoyer. Dr. Hoyer is the one who speaks with CDC direct. Other hospitals call CDC themselves, but they talk to them and they go through a series of in-depth questions of figuring out where would they have made contact with this, is it possible they could have got it, blah, blah, blah. If they determine that they think it's a possibility that they could have been contaminated, at that point, blood is drawn, that is sent straight to Austin. You get a preliminary test within 4 hours that it is received in Austin. So after that point, if it is positive, at that point it gets sent to Quantico. And that's when they determine the strain and all of the other stuff. That would be when they would be sending them out here. Is that it? We free to go?
Thank you so